My name is Michael Piorkowski. I'm a cardiologist and interventional angiologist, a very special specialty in Germany. I'm working in an outpatient department in the Bethanian Hospital here in Frankfurt in Germany. And I'm doing now peripheral intervention for more than 10 years. And I saw a lot of progression in these fields. The clinical burden of these patients is severely impaired lifestyle due to low walking capacity. Sometimes compare adjunctive with rest pain and some non-healing ulcers at the feet. But the majority of the patients have a claudication that is really limiting their life. And of course, we had many advances in the last decade for endovascular therapy, but there are still some patients, and not that few, that still need that don't have the exact treatment for their lesions, and especially for the fem-pop little axis. These are patients with very long occlusions that are heavily calcified, which are until now in many hospitals worldwide treated with open surgical bypass grafting. And these open surgical procedures are known for the last 40-50 years, but in the end, they have a high impact on the patient. They have a long hospital stay, they have some perioperative complications, wound healing issues, bypass occlusion. And there's a joke in German hospitals saying the vascular surgeon's triathlon, it's bypass grafting, revision, and amputation. So, and this is actually something that occurs until now every day in many hospitals worldwide. And that's why I'm happy to present here the study of a device which can overcome these issues. The PQ device, the DETOUR device, is a very keen thing. They try not only to reduce the issues of they don't try not only to overcome the issues of low patency in very long lesions, but they also designed a device for crossing these lesions. There's a lot of effort to overcome long calcified total occlusions if you're going in a subintimal way. With this device, you form an AV fistula at the proximal part of the occlusion, where you enter from the arterial, from the proximal SFA arterial to the vein, and then you're taking the vein as a anatomical guiding structure to pass or to bypass the lesion, and distal to the occlusion, you form another anastomosis to enter the native vessel again. And with the wire now pulled through from the arterial to the vein and back to the artery, there are stent-grafts placed, which now lead the blood, bypassing the former occlusion, and in a very keen interventional non-surgical way. And the DETOUR I trial was formed as a pre-CE mark trial to get a CE mark for treating patients in Europe. And this trial consisted around 80 patients that were treated, and they all had long calcified SFA occlusion. And the very important thing that the lesion lengths of these patients were around 37 centimeters in the mean of all patients. And this is really long occlusions. As a pre-CE mark study, there's two things important: the safety of the device and the efficiency. And for safety reasons, until now, 24 months after enrolling patients, there are no stent fractures, no stent migrations. They have only one patient with a major amputation. So for safety reasons, it's a very safe device. They have very low peri-interventional complications. They have a very short hospital stay and a very improvement in a functional setting. and for patency data as well is quite good. For the CE mark, there's only needed the 6 months data, but until now we have now the 24-month results. They can demonstrate a high patency rate of 80%, and this is for patients having really long chronic total occlusions, is very good data. The result of the study led to setting up the DETOUR II trial, which is now trying to get the FDA approval for treating patients in America as well, and to broadly enter the device into the market. This trial showed that it is possible to treat patients with an interventional device with a high patency, a very good safety, that were treated before open surgically. Yeah, actually, it did already. It led to the next trial to widely to widely install the device into the market. And actually, what I expect from the device, or if it's entered into the market, that we treat patients now with occlusions, they're reaching down to the below the knee vessels, to the P3 segment, and so we're having a bypassing that over the genicular junction. So actually, I'm waiting till the device enters the German market as well. We have a lot of patients that were treated surgically before, and that needs another revascularization, and our treatment options are very, very reduced because of many surgical procedures. So I'm really hoping to get this device into my hands as a normal patient treatment device.